What are the tests and procedures for adult acute lymphoblastic leukemia? There are certain tests and procedures may be used for adult acute lymphoblastic leukemia. In this video, I will discuss the most common ones. The first one is physical exam and history. An exam of the body to check general signs of health, including checking for signs of disease, such as infection or anything else that seems unusual. A history of the patient's health habits, and past illnesses and treatments will also be taken. Complete blood count with differential is also used. This is a procedure in which a sample of blood is drawn and checked for the number of red blood cells and platelets, the number and type of white blood cells, the amount of hemoglobin, the protein that carries oxygen, in the red blood cells, and the portion of the blood sample made up of red blood cells. Blood chemistry studies are also used. These studies involve the procedure in which a blood sample is checked to measure the amounts of certain substances released into the blood by organs and tissues in the body. An unusual amount, which may be a higher or lower than normal amount of a substance, can be a sign of disease. Doctors can also use peripheral blood smear. In this procedure, a sample of blood is checked for blast cells, the number and kinds of white blood cells, the number of platelets, and changes in the shape of blood cells. Bone marrow aspiration and biopsy is another common procedure. This is the removal of bone marrow, blood, and a small piece of bone by inserting a hollow needle into the hip bone or breastbone. A pathologist views the bone marrow, blood, and bone under a microscope to look for abnormal cells. Some tests may be done on the samples of blood or bone marrow tissue that are removed. There are two of them. I will describe them quickly. The first one is cytogenetic analysis. This is a laboratory test in which the cells in a sample of blood or bone marrow are looked at under a microscope to find out if there are certain changes in the chromosomes of lymphocytes. For example, in Philadelphia chromosome-positive adult acute lymphoblastic leukemia, part of one chromosome switches places with part of another chromosome. This is called the Philadelphia chromosome. Another test is immune phenotyping, which is a process used to identify cells, based on the types of antigens or markers on the surface of the cell. This process is used to diagnose the subtype of adult acute lymphoblastic leukemia by comparing the cancer cells to normal cells of the immune system. For example, a cytochemistry study may test the cells in a sample of tissue using chemicals dyes to look for certain changes in the sample. A chemical may cause a color change in one type of leukemia cell but not in another type of leukemia cell. The chances of recovery and treatment options for adult acute lymphoblastic leukemia depend on factors such as the age of the patient, whether the cancer has spread to the brain or spinal cord, whether there are certain changes in the genes, including the Philadelphia chromosome, whether the cancer has been treated before or has come back,